Half minutes. Mr. Johns.
Thank you, Mr. Chair. I'm just going to read a quick quote from just 2 weeks ago in the Vancouver Sun, and it states that in July 2020, the Canadian Association of Chiefs of Police expressed support for evidence-based medical treatment that included safe supply. Now, Victoria Police Staff Sergeant Connor King said that based on his experience, Dilaudid is not the drug most people want, and so the pills are indeed being sold illegally. But various prescription drugs have been sold on the streets for decades, said King, a court-certified expert witness on the trafficking of fentanyl, heroin, OxyContin, and cocaine and methamphetamine. He says that there has always been Dilaudid and OxyContin and other powerful opioids in the teen environment, high school and university campuses, end quote. He states, in addition, when I look at the coroner data, we're not seeing a link between safer supply drugs and lethal overdoses. King called their version of safe supply a small piece of an enormous picture as illicit drugs flow into BC via organized crime. Fentanyl coming into the province is highly toxic and deadly, and methamphetamines manufactured in Mexico and shipped or smuggled across the U.S.-Canada border are plentiful, powerful, and cheap. He says there's never been greater availability of cheaper drugs that are more toxic than the situation we face now, he said, and none of that has anything to do with prescribed or safer supply drugs. And he goes on to later say that, I'm a fan of looking for alternative ways for people to access drugs that are going to keep them alive, but I leave that to the medical community to sort out, said King. Now, we've heard similar responses from the City of Vancouver and their police department, the Chief Coroner of BC. What are you hearing from police? Is there a consensus, or overall, are you hearing the support is still there for moving forward with safer supply?